This is a CJASN podcast, and I'm Rajnish Mehrotra from the University of Washington. I'm privileged to have the opportunity to begin my work as the third editor-in-chief for CJASN, which is now a leading peer-reviewed journal in nephrology. It's worth remembering that CJASN started as a bi-monthly journal only 11 years ago, became a monthly publication in 2008, and now receives 6 times as many original research submissions as it did in 2006, over 80% of them from outside the United States. This has been possible only because of the tireless efforts and visionary leadership of Bill Bennett and Gary Curhan. As a result, the journal is now one of the most selective publications in the field and has a reputation for publishing articles that adhere to the highest quality of reporting for clinical research. It's not surprising then to note that CJASN is now the most read journal in nephrology. My team is fortunate to inherit the journal with such strong foundations, and we hope to build on this to take the journal to greater heights. Our vision for CJASN is to cement the journal as the leading voice in communicating and influencing advances in clinical nephrology. To achieve this vision, we have set 3 goals. First, rapidly and effectively communicate the most important advances in clinical and translational research in nephrology, including innovations in research methods and care delivery. 2, put these advances in context for future research directions and patient care. And 3, become an important voice on every issue that potentially affects the clinical practice of nephrology, particularly in the United States. CJASN will continue to place the highest priority and greatest effort in publishing the findings of the most impactful clinical and translational research in nephrology. The overarching measure of the importance of an original research article is if it either meaningfully changes how we care for patients with a given disease, or it tangibly advances our understanding of the condition and is a stepping stone for research in the field. We will use these 2 benchmarks to judge every original research article submitted to the journal. We plan to expand the scope of communication to become an influential voice on all aspects that affect the clinical practice of nephrology. This includes facilitating research prioritization, introduce new research methods for clinical research, offer research funding agencies a platform to share their vision and priorities, deal with issues as they pertain to the Food and Drug Administration, Centers for Disease Control, and Centers for Medicare and Medicaid Services. Ensuring quality and range of reporting is only one aspect of effective communication. It is imperative that the field of biomedical research adapts and leverages the rapidly increasing number of platforms available for communication in our society. This is important not only to widen the reach of what is published in scientific journals, but also to keep pace with how the millennials and the generations that follow them consume information. The editorial team at CJASN is mindful of this reality and hopes to implement a few early changes in this spirit. We will emphasize brevity of communication for our invited features, such that it is our hope that many such articles are bite-sized to be readily consumed on mobile platforms or through social media. We will soon launch podcasts for some original research articles, as well as periodic podcasts from selected members of the editorial team. It is our intent to explore avenues for engaging with communities established by the American Society of Nephrology and enhance our presence on social media. Our ability to sustain the trajectory of success for the journal will be determined by periodic assessment of our reach and impact through a robust culture of learning. It is our hope to build on the existing infrastructure of culture of learning at CJASN by expanding the range of metrics and data that we will receive and review critically to ensure fidelity to our vision of the journal becoming a leading voice in communicating advances in clinical research in nephrology. I want to close by thanking the American Society of Nephrology for entrusting this prestigious journal in our hands. And I know I speak for my very talented team that we are excited about the possibility of building on the work already done to take CJASN to new heights. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.